Hello, everyone, and this is the third part of our interview with Dr. Almeida from Recife in Brazil. And for this third part, we will talk about policies regarding COVID-19 in the country. But maybe before talking about actual measures being taken, what is the status, Dr. Almeida, with the epidemic in Brazil? Where is it located? What is the situation today?
Okay, the situation, we have two aspects of the situation because we are having new cases. I think the capital, the big cities, they are decreasing. They don't have more so many cases. But in the inland, in the small village, we have more new cases. So it is increasing. At the same time, Brazil is the first country now with more recovered people treated. And also the lethality in Brazil is around 5%. It's much better than many other countries. Even that the lethality can have different aspects in different cities, in different provinces, and in different social classes.
Can you elaborate on that? What are the social economic uh, parts of the population that are most affected?
Yeah, the population who lives in any places in neighborhood that don't have the basic conditions of water and hygiene and everything. So what happens is that those people, the people who are more economically in a bad situation, they have less access, they have less diagnosis, they have more comorbidity, and so the lethality is higher between them. In our city, in Recife, we have some numbers that can show that very well. So in the medium class neighborhood, the lethality is very high because the orientation is don't treat. Doctors are treating, but the official orientation is don't treat. So the public hospitals don't treat, and some big hospitals don't treat too in the first phases. What happens is that the lethality, even very high, is around 9%. But if you go to the periphery or to the poor neighborhood where the people don't have the same access, diagnosis, and treatment, the lethality is around 23 to 24. We have the data. It's not something that I'm saying. We are analyzing those data. And it was a study of the Federal University in Pernambuco, but they are not being told to people.
Okay. Okay. So, and in most states, maybe just to inform us, people even with no income or limited income, do they have access in theory to healthcare?
I
Is
did
there
not.
public healthcare in most of the states?
Yes, because our public service in Brazil, we call SUS, is the biggest one in the whole world. It's a fantastic system. The system is completely based in technology of information. So it's a fantastic system. But when the pandemic started, because of the orientation of the WHO, it was the same in Brazil. We don't have a treatment for the virus. You go home and you stay at home. And you only come to the public service if you have uh, dyspnea. So it was the orientation of the former Minister of Health. And don't use hydroxychloroquine. It can kill you with problems, cardiac problems. And so people were going to the public institutions and they were sending home. Because of that, doctors start to treat by telemedicine every group of people sick. So it was what happened before. And the medium class, the people who has money, they have more access to information. So they can have a better treatment. But the poor people with less culture and less ways to be isolated, because they cannot be safe.
Okay. So at the federal level, there is an army person with the Minister of Health, Mr. Pazuello. Can you tell us what is his approach? How does he involve medical doctors in the decision making, and what is the role of the federal government in Brazil regarding COVID-19?
The responsibility of the federal government in Brazil is to provide money and provide all the things they can do to help the province, we call states and cities in Brazil. Every city receives money to prepare the hospitals and the intensive care units and to provide all the drugs to the population. And the minister now he has a very good job, and he has a board of specialists, very high level specialists in Brazil. I think around 16 or 20 doctors that are in meetings every day, and the secretary of research is a new man now, very good one, and they are responsible for the policy and for all the things they should do to treat COVID. And they have a protocol of treatment of the first phases of COVID since May 23. They renewed the protocol. And so they have a protocol for treatment. And they approve the drugs, hydroxychloroquine, AZT, and zinc, and all of them. The protocol is like our protocol. What the board of I can say very expert people is working all the time. It's impressive. And what they did in every state, in every province, they have 3 or 4 representatives. I am one of them in my place. And we have meetings with that commission every Sunday at 6 p.m. And also we have an open channel with them that is open 24 hours a day. And all those doctors, around almost 100 doctors together, and all the people from the minister, we talk every day. So we know which city doesn't have a medicine, which city is going collapse, where we can help, where the minister can help, where we can help, because sometimes we stay until very late at night helping doctors to treat people, even if they don't have a place in hospital. And this is what called the protocol collapse. That is very beautiful and is working very well in Brazil.
And how do you get people from the states involved?
It depends on the city and on the state. Some states are doing everything right. They are doing and providing all the medicine. Some cities are doing the same. They have beautiful projects, and where it is working, the lethality is less than 1%. We start a protocol like that in a city that's big for inland. The name is Campina Grande, in Paraíba, in the northeast of Brazil. When they start that protocol, the lethality in 2 weeks was less than 1%. And they are treating, and people are being cured. So they have like a tent of a army, and they have doctors, they have everything. The patient goes there, the patient receives the drugs, and they have all the lab tests. They go home, they are isolated, and they are followed by telemedicine until they are cured. So we start that, and I was part of that protocol. I mean, one of the people working with the people of that seat. They are very good doctors, specialists too, like I said, neurologists, dermatologists, surgeons, and they are all involved on that. And it's a beautiful, beautiful thing.
Who took the initiative of this?
The community of medical doctors, and in that seat especially was the mayor. The
Okay.
mayor wants to change the thing in the city. Some cities in Brazil have the involvement of the authority, and the results are fantastic.
And today, with this kind of experiences, uh, isn't there a trend for having this approach throughout the country, or you still have mayors and states where they want to do it the old way?
The problem is that we have resistance. We cannot explain, we don't know why. So we are trying to work with doctors and with the community. The community has to say, I want to be treated, I don't want to die, and the obligation of the doctor is to treat me. We are trying to explain that to the society. Uh, but we cannot change the authority sometimes. Because if they don't want, they don't have a protocol, they say we cannot treat, how we can change that? We have to change the doctor and the opinion of the population, the Brazilian population. I think we are doing that because when we launched that protocol officially, it was working before, but when it was launched officially uh, last Tuesday, we had more than 25,000 people online to listen to that fantastic Zoom conference with many doctors, specialists in Brazil, and also with people from the Minister of Health.
So you gave an amazing example. Can you maybe give a sad or a bad example of something that happened that is about the contrary of this?
Yeah, we have bad examples, but like every country has, like
Sure.
I know today because I am involved in that and I know everything happened. Two cities in Brazil don't have medicine. Some people are going to intensive care units then without sedation with tubes. So this is dramatic, but we know because they ask for help and we try to help. We send the message to people on the ministry, to the secretary, and they try to help. One thing. The other thing that it was a tragic experience, but it became a very beautiful experience. Maybe you can interview one of those people because they have a beautiful thing to show. It was in Belém do Pará, a city in the north. They were working normally, they were having cases, but not so bad. And suddenly, the number of patients started to grow, and they did not have more any bed in any hospital, public or private. So people were dying at home on the streets. They were dying in ambulance because they did not have how to be treated. And the doctor said, we want to treat them, what we can do. And they had the experience of the collapse in Madrid that Dr. Marina Bucar was always teaching us. And so they tried to do the same experience. But in Madrid, they were using methylprednisolone that is intravenous, and they could not do that because they did not have hospitals. And so a doctor from Brazil in São Paulo, Dr. Roberto Zeballos, and an anesthesiologist, Dra. Luciana Cruz, that is from Pará, but lives in São Paulo, they they start to have contacts with the doctors in Belém, and they decide to treat patients at home. They went to their homes with very old people, more than 80, 90 people with faces very, very bad, like 2A, 2A, 2B. They start to treat at home. They try to get oxygen, corticosteroids, we call the protocol collapse. I think it's going to be published with also Dr. Zelenko in the United States. So they start to give pulse therapy with corticosteroids, anticoagulants. The docs went at home, and all the professionals of health, and oxygen and everything. 323 patients in that very critical state were saved. They had only one death. Only one death. And you know how many doctors died? 40 doctors died doing that. But they saved 323 people at home in a collapse. When it happened, one of the biggest health insurance company start to treat, and they can show the graphic. When they start to treat, they don't have more any patient in a hospital. All the patients are cured. They don't go to hospitals more, which is much cheaper for a health insurance company to pay for a very cheap treatment instead of paying for a hospital treatment that can take 2, 3, 4, 5 weeks because it's a very long treatment, or intensive care unity where the mortality is around 80 to 90% in every place in the world. And also, those patients never come back to their normal life. So this is a fantastic experience. I suggest you that you can call 1 or 2 doctors to show you how it was beautiful. I think it's a lesson for the world.
Can you explain why there was such high mortality among the medical doctors?
Because they are not using the prophylaxis. I think the prophylaxis is something very important in India, in the other countries where the lethality is very low. But in Brazil, the doctors now are knowing about that. Now they are starting to do. But at that time, I think it was 1 month ago, they were not doing that. And the doctors were going to treat people at home, to treat people. And so I think the protection, if you do that, is not so strong. And they died. A lot of people died. 40, I know.
And today, what is the prophylaxis that is recommended for doctors and more generally medical personnel?
Yeah, we have 2 kinds of prophylaxis in Brazil. One is with ivermectin. I told you 3 days in the doses that we recommend. That is 2 pills for until 80 kilos or 3 pills for people with more than 80 kilos during 3 days and repeat every 15 days. And the other kind of protocol is the same one as they use in India with hydroxychloroquine.
Okay. Okay. So how do you see this evolving? Because from what I understand, there is resistance still in several states, in several cities. Also, there were issues of availability of some of the medicines. How do you see the things evolving from your knowledge of the situation?
I think that we are giving up to convince the authorities. I mean, if you are against for, I don't know, political reason, whatever, I don't think we can change their mind. Only when we have a collapse, like in Pará. So the governor is supporting the doctors now. But we decided to work on the mentality of the doctors, making them know that they are completely responsible for the client. So even if the agency, the health agency says you don't treat, if he doesn't treat, if the patient dies, it's the responsibility of the doctor. The legal responsibility is of the doctor. And the second thing, we want to work with the community, with the population, to make them know. We have sites of the Doctors for Life. We have Facebook. We have everything to try to do that. And those kind of lives that have a very big audience, we are trying to have more and more. We are going to have one in the Assembly of Deputies, but we're not going to talk about politics, but to show the good experience in cities and the experience of 3 health insurance companies in Brazil. They are decided to treat, they are treating, and they have a very low lethality that is almost zero, and they don't have more patients in hospital because they are treating. We want to show that.
I read about Prevent Senior. That was more kind of retired people.
Yes, prevent, you start to treat very early. And it is a health insurance only for old people. The only experience they have is with old people. And they treat them and they don't die. And the hospital is working perfectly. They are working in hospitals. They don't have patients in intensive care unit, almost none. I have a daughter-in-law who lives in São Paulo, works for them. She works by telemedicine and sometimes presentially with the patient, and she knows that. It's fantastic how it works. It was the first
Yes,
one to start in Brazil.
it's really interesting, and I understand they were also involved in some kind of trials
Yeah, they
showing
have.
that there was a
I think,
reduced time
I think,
to hospitalization with the early treatment.
yeah, they want to publish, but when you want to publish a paper, you have to have all the bureaucracy. How you can do that during a pandemic? You are treating patients. I don't have time to have my patients organized to publish. We are now trying to do that because now we are having time because we have less patients. But when we were treating, we did not have time to organize our data, and
So
we have a lot of data.
how do you think the country will prepare for potential, the epidemic is still very active in Brazil, but it's going to go down, but probably there will be new small waves and spikes, and we don't know where it's going to go. But how do you see the country preparing for that?
I think this is a very difficult question, and it's a very difficult situation because during this pandemic, what happened to the economy is a disaster. So the number of people without jobs, the federal government gave money to them to help, but many people don't have what to do. They don't have work. They don't have jobs. Is the first aspect of this thing. The second aspect that I am always very worried about before I start to work with COVID is with the patients who are not COVID, because those patients in the whole world can have a change in the prognosis and the final history, because many patients, oncological patients, are not being treated. Some are receiving chemotherapy because for breast cancer before the surgery. Some are not having the radiotherapy. Some people cannot have a surgery. The number of cardiac arrests at home increased in New York at a very terrific number, 800% during the lockdown. And in our city, we had access to the data of cardiac arrest at home during the lockdown in my city, and the increase was 900%, almost like the number in New York. It's not a coincidence, it's an effect of lockdown. And also, besides that, in lockdown, you have depression, you lose your circadian rhythm. You don't know the sun, the day, you don't get sun, vitamin D, health habits, even walk. I am very happy now because Europe is coming back to a normal life, not to the what they call the new normal life. That for me is a nonsense. It's insane. I want to come back to my normal life. I want to go to Congress. I want to go to concerts. I want to go out. I want to go to the beach. Some things are so crazy that we are forbidden to go to the sea, but you can walk in the sidewalk and you can go to the bank agencies without any kind of social distance. But you cannot swim. Why you cannot swim? Because of the sand, because you cannot wear mask. Why you need a mask to go to the sea? Why? If you are alone or if you can make a social distance. I don't like this word of 1/2 meter of distance. I don't want that.
A question, answer if you feel comfortable with it. But you may have heard that several international universities have decided to go to Brazil to find volunteers for vaccines. What is your thought about using Brazilian people for testing vaccines?
I think it's a horror. I don't want Brazilian people taking vaccine. And also, I think that there's no vaccine for coronavirus. I think we have to live with coronavirus and learn how to live with. Because is there a vaccine for HIV? No. You have vaccines for H1N1 and for influenza, but you have to take every year one. And also, how many people die every year because of that? I think it's nonsense, the vaccine for coronavirus. I hate when they talk about that. We are trying to say to people, don't expect for a vaccine. You have to treat in the viral phase. You have to try to know what is the disease and how to fight the disease. And the only thing I think can be very good is what I'm reading about monoclonal antibodies. They are studying that in Holland, in Amsterdam, in Erasmus Center in Rotterdam, and also in Hanover together. And they are studying the same thing in Israel. I think this can work because this can really treat, like we can treat cancer with antibodies. Can be very expensive, but very efficient. But we have to treat in the viral phases, and hydroxychloroquine is much more efficient, I think, that remdesivir or another drug that they want to use. And what I can say about that is that I believe in numbers. And I was looking the numbers that we can see very easily in the John Hopkins Center. What I can see, the countries in Europe who did not treat at the beginning and they use isolation, lockdown, and things like that, or Sweden, they did not do anything like that. the lethality, if you compare Belgium, Holland, France, Italy, Spain, Sweden, England, is between 12%, 14%. If you go to the group of countries like Germany, Japan, South Korea, they made a very beautiful work on tests and correct isolation, because the isolation is of infected people. So, and they use antiviral. They had a lethality around 5% or 3% between that. When you go and you study the countries who use hydroxychloroquine since the beginning, ACT, like India, Morocco, Algeria, and El Salvador, Costa Rica, and also Saudi Arabia, Russia, the mortality is under 1%. It's around 0.8 or 0.5. If you go to Marseille, the mortality in the hospital of Dr. Didier Raoult is around 0.5%. So I believe in numbers. So I believe that hydroxychloroquine and that complex with the addition of AZT and zinc can be much more efficient to treat. And I see that on numbers. We have to believe on numbers. We cannot believe in what they say. There's no treatment, go home, and lockdown and things like that.
And maybe to conclude the interview, let's go into an area that is, you're a citizen of the world, and you're an influential doctor in Brazil. Brazil is an important country in the world community just by the sheer number of inhabitants. The World Health Organization continues to claim that there is no treatment for COVID-19. That is the official position. What is the message of yours towards the World Health Organization regarding treatment?
I don't believe in what they are saying. So I think they have to change. I don't understand them. I don't believe them. I don't obey them. I am a doctor. I have freedom. I want to keep my freedom. I want to treat patients independent of any bureaucrat agency. My message is that they have to forget the pandemic and let out the doctors of the world to treat the patients.
I have to thank you so much for this interview, and I wish you good luck with your continued recovery and your continued work treating people and your involvement in the community of medical doctors and in Brazil for this work you are doing. Thank you so much.
Thank you very much.